Okay, so it looks like everybody is, I see that there are some people that are still connecting, but it looks like most people have managed to get in okay. This technology isn't too bad. It seems to be working out all right. So in case you don't know who I am, my name is Larry Mraz. I'm Research Services Lead for the BC Support Unit, and I also do patient engagement out of the Vancouver office. And I'm really happy to invite you to this breakout session. There are several other sessions going on at the same time, but this one is Connecting Experience to Research is the session that you're attending right now. And we have, I'm very pleased to invite to us some panelists from Island Health Highland Center, Fraser Center, Patient Voices Network, and from Reach. So we have Taylor, Beverly, Jacqueline, Stephanie, and Manny joining us today on this panel. Hope I got all the names there. And so I just going to say that this is being recorded, if you didn't hear Taylor say that before. And we'll have question and answers at the end of the panel. And so I would like to invite our moderator to begin.
Hi, everyone. Thank you for joining our session today. I'm Steph Chia. I'm the manager of the Reach BC platform, and thank you for attending our panel presentation on Connecting Patients' Experience to Research, a review of different approaches to patient engagement in BC. And before I begin, I would just like to recognize that we are gathered today on the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people. Our panel presentation today will explore some different approaches that are currently being utilized across the province from the individuals you heard Larry mention today, and as well as a patient partner who's joining us, and that's Manny. So the panel presentation today will start with a little bit of a slideshow presentation from myself about Reach BC, and then we'll go into our discussion piece. So before we begin, I'll let our panel introduce themselves, and while they're doing that, I'll get my screen share started. So to begin, Manny, would you like to introduce yourself?
Hi, my name is Manny Vora, and I'm a patient partner, and I reside in New Westminster.
And then Tammy.
Hi, I'm Tammy Hofer. I'm the Director for Patient and Public Engagement for the BC Patient Safety and Quality Council, which some of you may know administers the Patient Voices Network. And I'm honored to live, work, and play on the traditional ancestral lands of the Lheidli T'enneh, otherwise known as Prince George. And for those of you who may not be familiar with the Patient Voices Network, it is a community of patients, families, and caregivers that volunteer their time quite generously to work with healthcare organizations to improve quality of care in BC. And currently, I'm pleased to say we are celebrating our 10-year anniversary, and we have over 1,200 members and growing.
Thank you. And Bev?
Hey everybody, I'm Bev Pomeroy. I'm a patient partner, but I'm also the patient engagement specialist for the amazing Fraser Center out in the Fraser Valley here in the Lower Mainland of BC, which is a collaboration of BC Support Unit, SFU, and Fraser Health.
And Taylor.
Hi everyone, my name is Taylor Hainstock and I am Bev's counterpart just here on the island. I'm the patient research liaison with the BC Support Unit Vancouver Island Center, and I'm both excited and grateful to be coming to you from my living room, my condo living room, but we're on the traditional territories of the Lekwungen speaking peoples, also known as the Esquimalt and the Songhees First Nations. Thanks, Steph.
All right, thank you so much. All right, like I mentioned, we're going to begin with a little bit of a presentation. So for those who aren't familiar with the Reach BC platform, I wanted to just tell you a little bit about the history behind it and what it involves, and that really will relate to our panel discussion as our panelists are going to talk about how Reach BC has kind of gone into their current workload and what we hope to see in the future for patient engagement across the province. Okay. If I can get the screens to work. Okay, so Reach BC is an online platform connecting you to health research in BC. Its The platform aims to connect British Columbians to health research opportunities across the province. And these can be both health research studies looking for research participants, but also patient-oriented research opportunities that are looking for patient partners. It was actually developed as a demonstration project of the BC Support Unit over the last 3 years. And during that development phase, we had a provincial working group that had many health representatives from the different health authorities, universities, as well as patient partners who helped provide context and input into what the design of the ReachBC platform would be. We also conducted several community consultations across the province to really gather feedback from the public as well. And this is the URL of where you can find reachbc.ca. The purpose behind developing the demonstration project and developing REACH came from a need in the province to really raise awareness about health research projects to the public. A public opinion poll showed that a majority of British Columbians actually were interested in participating in health research. Over 70% said they wanted to know more. However, only 15% were aware of those current opportunities to participate in research. And so that is a very large gap that is unfortunate because many researchers are also trying to find participants for their studies. And maybe one of the reasons why only 15% were aware of projects is the types of methods that are currently used, that are traditionally used for finding potential participants and patient partners can look something like this, which is a bulletin board in a hospital with many research study posters put on there. So the researcher is hoping that the right person, a patient, would be walking by at the right time, see their poster, think they're interested, and then grab a phone number and then contact the researcher. So there's a lot of barriers to really letting people in the public know about health research. You might have to go to a specific appointment where that doctor has been connected to a researcher and they want to tell you more about a research project. So there's just many different ways that researchers are trying to get the word out, but it's just not widespread enough. And with ReachBC, what we did was take that bulletin board idea and kind of bring it online so that it's a ReachBC directory that can be publicly searchable. There's a search bar that you can search by health topic, and you'll find research studies and these patient-oriented research opportunities for you to participate in. And if you don't want to be coming to the website to search for these projects on a regular basis, what someone can also do, is create a profile for themselves by joining as a ReachBC volunteer. And so when you join as a ReachBC volunteer, you create your own profile and you tell us what you want to hear about. You give us some demographic information, your contact information, and then you select your health research interests and categories. By creating this profile, we have a matching system. We'll then automatically search our research projects database and send you the matches that fit your profile. And then you'll be able to review in details of that, what that opportunity entails, and decide if you want to contact the research team. So this is a screenshot from the volunteer creation form where you get to select from many health categories what you're interested in learning about. So these are parent categories, and if you clicked on this button, it would open a menu of drop-down subcategories in that health research area. This is not all the categories we have. I couldn't get them all in one shot, but we have over 200 health research categories that are listed here. And this is a screenshot of what you would see if you got matched to a specific project, and you see some details. We provide you like what the age eligibility is, sex, gender, the estimated commitment, and then there's additional details listed like where it's located, who's the principal investigator, who's conducting the project, inclusion and exclusion criteria, and if you were interested in this project, you would just need to click this button that says, I'm interested, contact me. And by doing that, we will connect you with the researcher who's conducting the project. And you'll hear from them by phone or email about how to participate in this study. We've also been working really hard to coordinate COVID-19 research. Reach BC was launched actually at the end of April, and that was a little bit ahead of our anticipated launch date, which was more in the summer months. But because of the pandemic and a lot of the COVID-19 research that was going forward, we really wanted to make this Reach BC a resource for the public to find COVID-19 projects that they could be involved with. So we partnered with the CDC, BC CDC, about letting COVID-19 patients know that Reach BC is available to them to find COVID projects. And we've done some mail outs to COVID patients like these with this poster here, and really trying to raise awareness that researchers can also use Reach BC to share their COVID projects through to our volunteer database. So like I mentioned, we launched at the end of April. So these are our early outcomes of the number of people who've been using Reach BC so far. We have over 1,000 people signed up as Reach BC volunteers, which is really exciting to see. Over 35 projects now are listed on our Reach BC directory, both studies and patient partner opportunities. And 928 project interests have been clicked. I guess that's how many times people have clicked the I'm interested, contact me button. And then we know that researchers have enrolled at least 231 people through Reach BC. And I think the enrollment for patient partners has been about 24 patient partners were enrolled out over 8 patient partner opportunities. This is just a short graph to kind of show our growth over the last several months from April when we launched. We didn't do any major public communications or advertising at that time yet. We were focusing on getting our researcher users to post their projects on Reach BC. And then in July was when the BC CDC sent out a info card about Reach BC to COVID patients. And so we saw a jump in numbers from June to July. And then we've been doing a few other communications events, like I was a part of Bev's Sporecast podcast, and recently we had CBC cover Reach BC when they were talking about COVID-19 research in BC. So that was exciting to see. And we do hope that this number will continue to grow exponentially. And then, so the volunteers by region, a breakdown of where people say they're from, about 68% are identified as being in the Lower Mainland, almost 19% from Vancouver Island or the Coast region, and then Thompson Okanagan being the next largest. As you can see, there's the North, there's not that much representation from the North yet, but we hope that will change as time goes on. And then for researchers who create their accounts, we ask where their academic affiliation is. We have 56% affiliated with the UBC Vancouver campus, University of Victoria at 11.6%. These are some representatives from some other universities like University of Fraser Valley, Trinity Western University. Then we have SFU, and then some of these other universities here. And for our Reach BC directory, I mentioned we had over 35 projects currently on Reach BC, and the breakdown between research studies that are looking for research participants versus the patient partner research opportunities. I would say it's about 3/4 are the studies, research studies, and then slightly over 1/4 would be the patient partner opportunities. And so I think that's a pretty good percentage of patient partner opportunities. Of course, we'd like to see that grow in the future as well, but researchers are using it to look for patient partners for their patient-oriented research. We did a very informal survey of researchers who had completed their recruitment processes on Reach BC and just interviewed them to find out what was their initial feedback of using the platform. And so the researchers that I spoke to felt that Reach BC was really helpful for their recruitment. It will be an additional tool that they can use in their recruitment methods. And they found that for projects that are BC-wide, it can be very helpful for them because we are able to share their project through the different regions of the province. Okay, so I'd just like to acknowledge all the stakeholders who help support ReachBC, including the patients and the general public, the research institutes and health authorities and universities, and these are all of our partners, including our funders. So I will end my slide presentation here so that we can move on to the discussion panel, but just want to again acknowledge all the different people and voices that were a part of the development of ReachBC. I'm hoping that if I stop the screen share that I can kind of see, I see a lot of familiar names in our participant list today. And I was wondering if you had if you were a part of any process through the whole demonstration project development phase, you attended our community engagement sessions, or you sat on our patient advisory committee, or you gave feedback as a researcher, if you want to raise your hand if that's possible. I think there's a reaction and you can do like a thumbs up possibly, or the hand clap, but I would just like to see, I would just like to acknowledge you as well to say thank you for your all your feedback over the last several years. So thank you so much.
Definitely.
Okay, yeah, I do see some thumbs up, but maybe there's some new faces here that have not heard about Reach before. So we're happy to tell you more.
Sorry, Stephanie, can you hear me?
Yes, Vikram, yes.
Okay. Sorry, just a quick question. Thank you for your presentation, but I have a quick question with regards to Reach BC as an organization compared to the other organizations out there. You mentioned SPORE and then you mentioned support unit and stuff, but I want to just get a sort of quick synopsis to understand the relationship with all these organizations, what each of their individual purposes are. So are we not, hopefully we're not all trying to reinvent the same wheel.
So how we're related to support unit and some of the other organizations?
Yes, and then just in terms of how you're different compared to everybody else, right?
I guess for ReachBC is we're not technically an organization, but this is the platform that a physical or online platform that is a tool for researchers and the public to use to find health research opportunities. That the platform itself was kind of aligned nicely with a lot of priorities of the support unit, Clinical Trials BC, and the Academic Health Science Network, and UBC, and Vancouver, like some of the health authorities as well. So I think there was a lot of collaboration with these different organizations to see that this platform get built so that they could use it in their own, for their research departments, or help them achieve some of the priorities that they had.
Okay, so from what I understand, in the whole cog of the whole system here, research and patient-oriented research, REACH is focusing on actually matching the researchers and the opportunities with the patient-oriented patients, I guess. Is that right?
Yes.
Okay, thank you.
Okay, thank you. And we will hear a little bit more about how we have worked with the different organizations with our panel discussion. So you will hear, I guess, how the different, like Fraser Center and Island Center, and how we've worked with Patient Voices Network to help further patient engagement. So I will now transition to our discussion time. And for the first discussion question, I would just wanted to allow Manny, our patient partner, to tell us a little bit more about himself, and tell us, Manny, if you can, how did you become a patient partner, and how did you go about finding health research opportunities to connect to?
I've been in the middle of a bit of a transition in my career, coming from engineering and project management kind of background. Always been interested in healthcare. Been wanting to make that move for a little while. And so I was looking for some volunteering opportunities online, and just Google searched. And I'm trying to get public health now. That's my new field. So, and I found ReachBC through just searching online, Google, ReachBC, Google. And yeah, that's pretty much it. That's how I really found it, and found it pretty easy to use and maneuver around.
Mm-hmm. That's great, because I guess when that public opinion poll that took place maybe 4 or 5 years ago, when people weren't aware of how to find health research opportunities, ReachBC obviously wasn't around. So I'm glad that you were able to get to just Google health research and find ReachBC and then get connected to opportunities. Now I just want to pose a question to our patient engagement specialists from the different organizations. So Bev and Tammy and Taylor, what are the ways that you have supported health researchers with patient-oriented research and connected them to patient partners in the past? So this would be before ReachBC. What are the different ways that you're doing patient engagement? So Bev, would you like to share?
Yeah, sure. Thanks for that, Steph. I guess for me, because I'm new to my role as a patient engagement specialist at the Fraser Center, I just started in February, March. So prior to that, I actually was a patient partner out there. And from that perspective, really, there were a couple sort of avenues that I could find opportunities, but quite often a lot of them were just word of mouth. We have a pretty good relationship with all of us as patient partners, and somebody would send me this way and someone would send me that way, or an organization would contact me for this. And it really was, a lot of it was word of mouth. And of course, what Tammy talked about was Patient Voices Network, which was sort of the online version of the dating site for that. But once I started my role with the Fraser Center, Reach launched, I guess, in June. So it was only a couple months that I had the opportunity to sort of be pre-Reach in doing the work that I'm doing. But a lot of the work then, because there are already a lot of established patient partners, so I didn't really have to sort of go and find new patient partners. So my role really was around supporting the researchers with their grant submissions, ensuring it was meeting patient-oriented research sort of, framework. We do have sort of an initial sort of financial resource for researchers before they get their grant to help them and steward having patient partners from the very beginning and co-lead the projects themselves. So I'm a little bit at a disadvantage, I think, and Taylor's probably had a lot more experience, as has Tammy, with sort of patient engagement pre-Reach.
Yeah, Tammy, I'm hoping you can share a lot about the Patient Voices Network, since it did take on a lot of the role that ReachBC is now doing prior to the platform being available.
Yeah, thanks, Steph. So just a bit of context setting, similar to Bev. I'm fairly new in my role. I guess, can I say that anymore? I'm just over a year as being the director at the Council for Patient and Public Engagement, which administers the Patient Voices Network. So ironically, previous to that, I had the pleasure of working at Northern Health and being the co-lead for the BC Support Unit Northern Centre. So I was similar to Bev and Taylor and yourself on the other side of it. So in thinking about this question, I really needed to reach out to those in my organization currently that did provide pre-Reach BC, pre-BC Support Unit support for health research. And what I understand is previously that process for supporting patients to engage in health research was very similar to how we would support patient engagement for other things such as quality improvement. And so typically the health researcher would come to, I'm going to refer to the Patient Voices Network as PVN, would come to PVN, and we would work with that health researcher to really understand what their needs were, how many patients that they were looking to engage with, support them through the engagement request form process. And then, of course, I like Bev's term, the dating service, so providing that matchmaking. But I know from the team that there was a lot of varied comfort in being able to appropriately support health research. And in large part, that was due to some of the ethical considerations that they had to think through as researchers were coming to PVN. And what I mean by ethical considerations is, was what was being brought forward to us truly patient-oriented? Did it align with our principles for authentic engagement? Had the researcher received all the appropriate ethics approvals? And how could we be assured about that? So there were a lot of concerns about us dabbling, if you will, in supporting health research because it wasn't something that we had historically been part of. and didn't necessarily have all the supports and processes and training and everything in place to do it really well. And thankfully, when the support unit started, even before Reach BC came along, at least we had somewhere to connect through the regional centers to help us along that journey. But even then, it was still sometimes hard to determine which regional center to go to, and our processes were still somewhat disjointed. So that was prior to Reach BC, and that's a little bit of the historical context about how we used to support health research from the Patient Voices Network.
I want to add to that, Tammy, that I think with the PVN and this excuse me, and the engagement opportunities that are there, it's very sometimes we get to see the results of our contributions, whereas with research, I understand it takes a very, very long time before the patient is going to see anything of their contributions, because of research taking a long time, I guess, right? So thank you, Tammy, as well. I just think just want to point that out.
Thanks, Vikram.
Thanks, Vikram. I think we'll probably come back to that question, your comment too, at the end with some of the future directions of where we see patient engagement going and Reach BC. But I'd like to invite Taylor, just kind of share what goes on in the Island Center. What are the tools and resources you use to engage the patients on the island?
For sure. Thanks, Steph. So lucky for us here on the island, the BC Support Unit Vancouver Island Center is actually housed in Island Health's Research Department. And so pre-Reach BC, pre-BC Support Unit, our Island Health's Research Department had at its core a belief in engaging patients as partners in as many aspects as they could within the care setting. And so building on some stuff that was already established from day one of our BC Support Unit Vancouver Island Center, we wanted to make sure that we had a priority, or it was a priority for us to have a presence in our community. And so we quite literally hit the pavement running to spread the word to folks that we not only existed, but that we are a resource for pretty much everybody to tap into. So all stakeholders who want to contribute to patient-oriented research, we were here to help make it happen. So we focus heavily on outreach and communication activities across the island. Although we are on an island, it's a really big island. So there's a lot of areas that we have to reach out to in traditional ways, face-to-face, in person, online, sort of as many different ways that we can. We attend everything literally from local health shows to volunteer fairs. We do guest lectures, we do booths at conferences. We kind of tap in and leverage our own personal relationships and connections and networks through past school, past careers. And we kind of just make our presence known as best as possible. And so it's these sort of foundational relationships and connections that we found to actually be a really strong starting point to support patient-oriented research and to support our researchers and our patient partners. So I don't really know if it's the right way of saying it, but like we support our patient partners and our health researchers in whatever way that we possibly can. So like a best friend would support a best friend in picking up the phone and giving them a call. And we just try to make it happen for people. So I guess if you want to think about like processes pre-Reach BC, about how we engage patient partners with our health researchers, we usually have a starting point. We have a starting phone call. Often our researchers are coming from the academic world, so University of Victoria. Lots of our patient-oriented research folks are coming and starting at that point. So we always start with a navigator phone call to just sort of get the lay of the land. Does the team have a good understanding about patient-oriented research? Can they differentiate between patient partners and patient participants? What outcomes are they hoping to achieve out of these engagements? And then after that initial meeting, we kind of come back as a full team and say, okay, we're going to chart our next steps. So who are we going to talk to next? Usually that's when I start to get looped in, because as we know, there's a lot of relationship and planning and logistics around engagement, as much as I'm a firm believer in it's just human to human conversations, but there are some elements that are new to people in this type of work. And from there, it's a pretty hands-on approach. And I think pre-Reach BC, that's something that the island prides ourselves on, is that we sort of wrap around whoever needs our support, and we kind of make it happen in whatever best way possible. Super important step is I do a lot of like, what's my gut telling me? Does the person get it? Like, does the research team, is it going to be a meaningful engagement? And I listen to my gut a lot, because sometimes some teams, it's super natural for them to work with patient partners, and other teams need a little bit of a stepping stool to sort of help them out a little bit. So pre-Reach BC, super hands-on. And I know we're going to talk about sort of after Reach BC, but yeah, I think that's sort of the way that the island has approached doing things.
Yes, I definitely noticed your team being very hands-on and being able to provide all those, personal connections with the researchers as well as the patient partners. I think the BC Support Unit Regional Centers has been, Reach BC relies heavily on the work that's done at the regional centers and the unit itself in order to engage both the patient partners and the health researchers. So the next follow-up question is, you told us about what happened pre-Reach BC. Now that Reach BC platform has launched, it's a digital platform that's aiming to connect the patient partners directly with these health research opportunities. How has that kind of changed how you work, and how did you kind of put Reach BC into your normal everyday work, I guess is the question. Tammy, maybe it has impacted PVN quite a bit, because this is work, like you mentioned, that you were posting these patient-oriented researchers previously through PVN. And so we've developed a coordinated approach together, but maybe you can share a little bit more.
Yeah, absolutely, Steph. Thanks for the question. So at the council, we think it's very important that every door is the right door for patients and families and caregivers, whether they want to get involved in health quality improvement, health policy, health research. So it was really important for us to work with the BC Support Unit and Reach BC to create a streamlined process that made it easier at least for both health researchers and patient partners to connect. As well as avoiding that duplication and confusion between our organizations that Vikram alluded to a little bit earlier. So we did collaborate very closely with you, and we've developed a joint process to connect health researchers and patient partners directly through Reach BC. So if we are contacted by a patient partner or a health researcher, we usually direct them right to Reach BC. We've even included a spot on our PVN website specific to health research and Reach BC to make it much more easier for people to be able to engage. And, it's working really well. I understand the feedback has been fairly positive. And then we can talk about some of the challenges as well later on. I know that's coming. But one of the things that certainly has done for us, I think, is build our capacity to support patient engagement in other areas. Because similar to what Taylor was talking about, that really wraparound, hands-on approach to supporting health research, we were also trying to provide. And because that's what we do with other engagements as well. So having the support unit in Reach now in BC has built our capacity to not have to necessarily provide that level of support in regards to health research, which has then freed us up to getting back to health quality improvement, health policy, governance, and all of those other aspects of improving the health system. So I would say it's been working really well, and we've really truly appreciated all the collaboration that we have had through the support unit and through Reach BC.
And it's probably seamless now when you joined PVN, since you used to be part of the BC Support Unit's Northern Center. Bev, could you share a little bit about using Reach BC, the digital platform, in your role at Fraser Center? How do you think it's changed how you work with patient partners or health researchers? Oh, you're muted.
Yeah, of course, I'm always muted. I know when we first, were sort of talking about this, I really struggled with how to articulate, how to answer this question, because it definitely has increased my workload. There's a lot more work now because, like Taylor, the Fraser Center really takes a hands-on approach to both its patient partner engagement and researcher partnerships. So, like Taylor, we work hand in hand with researchers and patient partners and, our healthcare organizations to find the right match and to ensure that patient-oriented research is occurring in a way that, isn't harmful and, is going to be successful and have these amazing outcomes that we know it can have. So having REACH now sort of part of that process, so I'm now taking a hands-on approach to REACH, which means, like one of our research navigators will introduce me to a researcher who's looking for patient partners. I then, with that researcher, log into REACH and, we both sign up and I then help them create that posting. So, before we would create the posting on PVN and we would send it to PVN and PVN would then take the bulk of that work. But now, thanks, Tammy. But now, I think Steph owes us a couple bottles of wine, I think maybe in the future. But, so now what we have to do is which is fine. I think it's amazing. And, so we really help walk them through that process. So having said that, it really has provided an opportunity, using REACH to, I think, collaborate even more with our researchers, in that we create the opportunity together on REACH, the researcher or the research assistant or the PI in that recruitment versus relying on me or another agency to find a patient partner that fits. So with the researcher, we go through the process together from beginning to end. And what I'm noticing is that, the researchers, when they log in, they can see every person that has put their hand up to be a part of their project. So it's created a tremendous amount of transparency for the researchers because they basically see everything. So it really fosters collaboration and opportunities for us to build capacity in POR in a really transparent way that I hadn't quite anticipated, with REACH, because they do have to create an account and they have just as much access as I have. There's this equity between the patient engagement team and these researchers. And that's what I find actually really interesting. It really creates that sort of coalition of support for each other. And on the other hand with patient partners, because I am one of those as well, is quite often, and we know this in the world of patient engagement and in our community of practice, is sometimes we can fall into gatekeeping. As patient engagement specialists and organizations, we're like, oh, that person's already doing too much, or, oh, no, that person's just had this situation, which is great because we are, looking after our patient partners, but it can fall into gatekeeping. And so REACH really is set to self-serve for researchers and the patient volunteers. So for those reasons, like, that's just kind of how it's changed for me, like both I've got more work, but it's just been a really interesting process over the last couple months of kind of using REACH in partnership with researchers and patient partners.
And I'm sorry for the extra workload. I guess what I would we're hoping, and I'll mention it probably later too, is that we're building capacity with the researchers, and you being able to join as an additional team member on these projects to log in together to Reach BC, I think is the beginning. And maybe down the road, you'll see that these researchers hopefully are, more aware, they have the resources and the training required to do this and feel confident to be able to take on those projects themselves, where you are no longer needed, your services are no longer needed, right? That I think that's even the support unit's whole, one of their goals is like to make the researchers at this level of awareness and be able to do that. So apologies, but thank you for for helping support the researchers in your region. Taylor, do you have anything to add from the island?
Yeah, I can just quickly add it. I know ditto is probably not the acceptable thing to say. Oh, everything that Bev said, thumbs up, but really quite similar. So we work in partnership with our researchers to then post on REACH. So it's, I think here on the island, we have what we started from day one was a patient partner registry. So a registry of folks on the island who are interested in patient-oriented research in some way, shape, or form, no commitment, just interested in learning more about opportunities. And And I can say I fairly confidently that I've met those 190 people at some point in these last, like I've met them face to face, and that's how they've gotten interested and connected. So Reach BC, I don't plan to use to replace what we have going on the island already, but it's an additional tool in our toolbox. So if I have researchers who are curious or interested in reaching a broader audience, Reach BC is an amazing platform and an automatic, oh yeah, let's post that on Reach, because all of a sudden, instead of just the island or me passing an opportunity through each regional center counterpart to spread out through their networks, it can just, we automatically can get it up and onto Reach. Different audiences is also a really nice benefit of us using Reach. And then there's one other thing I was gonna say. Oh yeah, it kind of similar to what Bev was mentioning, it shifts the way our hands-on approach. It's a little bit more hands-off and sometimes entirely removed. And there's pros and cons to that sort of a platform. On one side, it definitely gives our patient partners, our public, our members of our communities, a lot of, like a huge amount of autonomy. They can do it on their own time, when it meets their needs, when it works best for them, which is fantastic. But on the flip side, having been so hands-on for so long, and now I'm super aware of the gatekeeper comment, Bev, that you mentioned, because it is really easy to slip into something like that. But who's there to support the relationship building that we force on teams sometimes right out of the gate? Who's there if things go sideways? Who can they ask for a bit of, what happened if this, they missed a meeting, what do I do here? Or there's those like kind of back and forth quick questions. There's maybe not somebody there that they have a relationship with, the research team rather, to ask. And then I don't know if this is just sort of on our part, is that as we build capacity, should regional centers really be trying to just push out more learning opportunities for teams, so that if and when they decide to use Reach on their own without connecting to a regional center first, do they have enough in their back pocket to be able to navigate when things go sideways? So I don't know if it's just sort of a thinking future. Our regional centers will have to do maybe a little bit more training and learning and building capacity within our research teams, so that when they do go off and sort of do that on their own, that they feel well equipped and sort of ready to go.
Yeah, I really appreciate the discussion points from everyone so far, and that this is something that we've talked about throughout the development of Reach BC, is like what will happen when it goes live and you allow people to do this themselves, and how do we make sure that they know what they're doing. And these are all really interesting points that I think we'll be able to maybe find out more now that we have like Reach BC online and people are beginning to use it, and those connections are being made during our outcomes and evaluation time. There's going to be some information that we can pull from the users. So it will be really interesting to see what we learn. All right, so heard enough from the patient engagement specialist for now. I want to hear from Manny again. Manny, can you just tell us a little bit about what it was like when you signed up in Reach BC as a volunteer, and then how did you get matched to the opportunities that you actually got linked in and connected to the research teams?
Yeah, I would love to. It was, honestly, it was very easy. I thought the website was pretty user-friendly, and from the get-go, it was creating your profile, starting with general questions about yourself, and then selecting your health research areas that you're interested in. So I picked those, and then basically system would generate certain opportunities or match me with certain opportunities that is on my interests. And then I look at those I basically looked at all of those opportunities one by one, and to see which one I wanted to take further or actually apply for, or just say interested in. Because I just click on that button saying interested in. And then, one more thing I had to look at was I eligible as well? There's eligibility as well at the bottom, so you can see that. But at the same time, before I even express interest, if I'm not eligible for it, there's no point. So like I said, it was very user-friendly. And then after that, basically, you would get let's say I pick something and I would get an email a few days later talking about that opportunity that you were interested in, is there, can you explain more why you were interested in this opportunity, for example? So that's something that I've done that in the past as well. So just to say that, yes, I'm interested, this is why I'm interested in it.
Mhm.
So then from that point on, it was pretty easy. Virtual meetings so that's, I found, yeah, overall very good experience.
And I'm interested, these were your very first opportunities that you were a patient partner in. Like you never did that before, right? Before
Never.
HBC.
So this is definitely my first, yeah.
And how did you feel supported as a patient partner your first time being in this health research, talking to health researchers and giving your voice as a patient partner? Did you have
Yeah,
the resources and support that you needed?
yeah, absolutely. It was from the get-go, it was very open, collaborative. I felt comfortable and confident. They gave me all the confidence as well, right? I mean, I didn't feel like an outsider looking in, anything like that. If I had any questions, I could reach them by email or phone. They were very accommodating in terms of fitting in my schedule and that kind of stuff. It was very meaningful engagement. I think somebody mentioned that word before. So overall, I think it was a great experience.
Great. And I'm sure there'll be many more that you'll find and connect to through Reach in the future.
Yes.
Okay.
Yeah. I'm hoping that's my plan anyways.
Great. I'm just looking at the time, so I'm gonna jump to our last question, which is really looking at the future of where patient engagement is going. We have ReachBC, this digital platform now available, but we talked about how it's created some more work and had to change the regional centers' approach to some things. But where do you see the future going? And that can be coming from where are some challenges you see right now and where we should be going in the future to address those challenges and maybe improve how we engage patients in research. Does anyone want to volunteer to start, or should I call on?
Yeah,
Bev?
I can go. Yeah, I can go. Since I already mentioned one of them. I just want to say that, Reach BC was, sort of, not that you forced your hand, but the platform really was released early due to COVID, right? So appreciating that, with digital platforms, that there's this iterative process that we're in. And I'm grateful that we all collaborate and are able to, send you a note, Steph, or a message to say, this is what we'd like now. So I'm super grateful for that. And I think that's really important that we have that sort of, open communication. So there are some things obviously in workflow that we have to address. But of course, my whole soapbox is around patient partners and patient engagement, and in particular, patient-initiated projects. And if I had my nirvana with Reach, it would be an opportunity for patient partners to post projects or questions or ideas that were interested to them and their community or their associated disease or condition, and that through that, a research team can be built around them within each region or whatever that happens to be. So that's kind of my nirvana of what I'd like to see Reach. And the other thing, I'd like to see too, and I know we struggle with this in patient-oriented research kind of in general, and on the plenary we talked about it as well, is when we're aggregating offline and online and we're talking about community and we're talking about vulnerable communities in particular, where's our responsibility or the ethics of ensuring no harm? And so I still think, whether you're using a digital platform or you're doing offline, I still think we have some conversations around that need to be addressed, I think, in general, in the work of patient-oriented research. So those are sort of my two caveats to using Reach, but super grateful that at least we get to contribute and participate. Steph.
Yeah, that's a great idea about the patient ideas, capturing that and then using that as a way to connect them to researchers. Because we have the two users in Reach BC, it's just maybe expanding what we use those two, how we connect those two users, right? Taylor nodding. I guess you agree. Anything you'd like to share with the future about some future opportunities?
I guess mine are less concrete maybe, but a pipe dream is sort of breaking down the rigidity of all of this. So patient-oriented research is a thing. It's a thing now. And I think I've talked in other avenues or other channels with people about I've been a firm believer for a long time that we kind of just have to reduce everything down to having meaningful, respectful conversations, human to human, instead of it being a rigid process and there being barriers to who can talk to who when and how to approach it. And I totally get it. I think that it's important to have some processes so that eventually this just becomes the norm. Having conversations with people who have that experience is just a duh kind of situation. But for some folks who haven't been doing community-based research or haven't been doing participatory action research for their entire careers, then it is new and it's kind of confusing and it's complex and uncomfortable sometimes. And so there are people like myself and Bev who are there to sort of support teams and to kind of make your way through it. But in my dream, we wouldn't need people like this, or maybe it's the other way around. We need to start to clone people who are there to just embed on every team to just be a resource if people have questions, until it just becomes totally natural for everybody to just have a conversation with somebody, let that inform your project, and then go forward together. And to yeah, I don't know. I was trying to think of some analogy on, like, if I was to say to my boyfriend, come to a research team meeting, what would I do to prepare him for that? And just make that the norm. Like, I would never just plunk him in at a meeting and be like, good luck. I would give him some background information. And that's just the way that I would be. So like, let's transfer that just way of being into this patient engagement work that we are all trying to move forward. So I don't know. It's not tangible and tactile, but it's that pipe dream.
I just want to add to that. Yeah, I think that's so important. And I think Taylor and Bev, you've spoken really well about the human side of it and the importance of relationship building. And just leading into that, right? Like, it's important to have evidence and measurement about why engaging patients and families and caregivers into everything we do into healthcare, like health research, health system improvement, is so important. And that's where I think there's an opportunity for us to continue to collaborate. And so, speaking on behalf of the Patient Voices Network and the Council, one of the things we used to be able to do by facilitating health research engagements was collect data around how many of our members are getting involved in health research, what was their experience like being involved in POUR, and then what was the impact that it had. And so I think now that we're deferring people over to Reach BC, while that is so great to empower people and take away that paternalism and building agency, I think that's so great. But at the same time now, from our side of it, we've lost the ability to ensure that our network members are having a positive experience and that there is a closing the loop around impact. And so I would like to see, my future vision is that we continue to work together around how we build our evidence about why patient engagement is so important in improving the health system.
Definitely agree that we will continue to work together to identify what are the key outcomes of like this Reach BC platform having on the different patient partners and health researchers, I think, as well. We do have plans for outcomes evaluation activities this year. Now, like our whole past couple of years have just been focused, like get the platform done and live. And so now that it is live, we are now collecting data as people are logging in and using it to make those connections. And I think there's a lot of good information that we can pull out of there, and then that will also help us identify areas where we want to improve or things we want to develop. One thing that I know for myself, for Reach BC, we're looking to expand also, like to increase the awareness of patient-oriented research in general. So not just the projects that are currently looking for patient partners, but just so that the public wants to know what patient-oriented research is going on right now and what has been going on in the past. So that would be expanding our database of projects to include those that are ongoing, that are done recruiting, but they're ongoing right now, or they have been completed, and then sharing data from those projects of both how did that patient-oriented research project, like what did they find from that project as well? But not only for patient-oriented research, I think this is equally as important for research participants in research studies. There's always all those articles about participants wanting to know like what happened with this research project. Vikram even brought it up that these research projects can take several years to be completed, but and then there's like a drop off of communication between the researcher to the participants of what did that study find. So we would be exploring that for Reach BC with the BC support unit who is leading this patient-oriented research registry project. So exploring how can we expand the use of the Reach BC platform to help raise awareness of the patient-oriented research, but as well as closing that loop and sharing those findings. I wonder if there's anything else I want to add, but maybe Manny, I'll maybe give you the last word if there's anything you see for the future of patient engagement. Oh, you're muted, Manny.
I think this is a great initiative. Personally, I feel there is something to be said about this. Like overall, my experience has been really great. Just for the fact that being able to bring in different perspectives, and that's been really wonderful. I feel, and just being receptive to discussions. I think that was another thing I noticed was great. I'm sure there can be improvement somewhere, but at this point I think it just started a few months ago, and I think it's been wonderful. I see a lot of progress and a lot of scope coming up, and I'm always looking at different opportunities when I get the emails, and it's exciting.
Thank you so much. I think we're about the end of the session. I know there's probably so much more we could talk about, but we'll have to save it for another time. Larry, is that anything we should do now?
No, there were no questions in the chat, and I think we are at the end of our time. So I'd like to just take this opportunity to say thank you so very much, Steph, for moderating the panel. And I'd like to say thank you for Tammy, who is not Jacqueline. So sorry for that mistake earlier. Manny, great to have you here. Bev and Taylor, of course. Thank you so much on behalf of the support unit and everyone who attended today. And I'd like to thank all the audience members for coming to this as well. And I'd like to remind you that we have our last session of the day starting in just a minute, 1 minute, so you have to rush. And this is the second plenary session. It's a panel session on patient-oriented research and health technology. So you'll want to see that. And then, of course, after that are our closing remarks. So we'll see you in the next session where everyone's going to gather again. So thanks once more, and goodbye.
Bye.
See you later, everyone.
Bye, everyone.